Good evening all. Protocol already being established by Dr. Eastman. I now take over, although I think Dr. Eastman has really given us a real idea of what we're here for and what he believes. As Dr. Eastman intonated, he and I are kindred spirits. We're both passionate about continued education, development and growth within our profession. My duty this evening is to be Master of Ceremonies. I will be doing that obviously to make sure that the evening continues to run smoothly. But I will start off by saying that in his book, I read a book by an American surgeon called Atul Gawande. It's called Better. I don't know if you've ever read it. And one of the phrases that stuck with me when I read that was betterment is a perpetual labor. And as you spoke about betterment, the reality is that we're going to have to be always at it. I think it's a calling. And there are many of us who come here year after year who believe that, who that is part of our existence, where we're constantly looking for better. Our charge, of course, is to spread that throughout our profession and allow the others in our profession who are not here today, who might not be here this week, to understand that for us to improve, we have to do it together. It's no point 10 of us coming here and the other 15 not being here. We all have to work together if we really want to improve this profession. This evening, we're going to have a Dr. John Maggirias. He is the CEO of Dental Analytica. He's going to be giving us some remarks. I met John a little while ago, and he was able to give me some insight about his company. And he has a very interesting company using data. And data can be very overwhelming. For any of you who've done any statistics or analytics and have nightmares about programs like SPSS, as I do, sometimes data can be a little bit intimidating. But those of you who like data can use that data to really help solve problems and come up with solutions in ways that are faster than it takes if we try to work it out and make several mistakes along the way. It seems as if John's company has the capacity to do that. His company uses the data to improve access to quality care and also to create performance-driven solutions. So I really look forward to hearing from John and how his data can help us make better decisions. Dr. John Maggirias.
Honorable guests, Dr. Eastman, and fellow colleagues, I am honored for the opportunity to share a few words about the changing times of dentistry. As dentists, we are gatekeepers of the body, and we need to be guardians of the profession alike. We are on the dawn of a truly transformative era. Profound changes that have not been seen since the Industrial Revolution are upon us. The majority of my life has been spent in the information age, but we are now emerging from the information age to the analytics age. Predictive analytics, machine learning, and artificial intelligence are in the media all the time. And these items will completely transform our world and dentistry as we know it. Once upon a time, we looked upon the heavens to ask questions that would help us understand our fate. Today we ask Google, Siri, or Alexa. Ironically, they're also up in the cloud. There are vast amounts of data in the cloud with ever-growing computational power. The calculations are growing infinite in multitude, and the answers we need are found through this data. Think to yourself how the internet is now part of your life. Think how it was part of your life 10 years ago. Those changes are rather evident. Look no further than your smartphone and what it means to your daily life. Will our smartphone one day know us better than we know ourselves? These mainstream technological transformations left me wondering how this will impact the dental profession. In the last couple of years, I've developed strategic partnerships with the University of Toronto, where I once served as a research director in the Community Dental Health Services Research Unit, and I studied population data. And back then it was all about SPSS and statistics. But times are changing. And if anyone worked with these software programs, you'll be keen to say that we did big data before big data was big data. We've also partnered with Stanford University and have developed aggregate data to help understand what is happening in our profession through numbers. The University of Toronto recently got $100 million as a donation from Heather Reisman and Gerald Schwartz, who are friends of mine, for funding an AI institute. The work of the Creative Destructive Labs, which sounds pretty interesting, but the work that they've been doing has been transformative in developing companies in AI, a think tank, if you wish. So how do we navigate the changing times of dataism, algorithms, and pivot to the new world of artificial intelligence? The carbon age of life has been around for millions of years, and we Homo sapiens emerged 200,000 years ago. But silicone chips have only been around for 50 years. And their exponential rise leads me to believe that artificial intelligence is just around the corner. And I've seen it firsthand on the campuses of Stanford and Silicon Valley and my alma mater, the University of Toronto. And how is dentistry prepared to evolve in this capitalistic society that is built on evolve or perish? Will humanoids, as seen in shows like Westworld, be the front desk staff of tomorrow? Will IoT, the Internet of Things, transform the dental chair, where we'll be able to know from our iPhones, for example, when a chair was last sterilized, or when the lines were last rubbed, or how long a patient has been sitting in a dental chair for treatment, or how long it takes for a dentist to cut a crown, because we all have stories about how long it takes us to cut a crown, right? Information is going to be where we need it when we want it, and patients are going to start to demand this information, this transparency, and those times are upon us. My firm, Dentalytica, has been working on just these questions. We are building the first dental data bank as a non-profit organization to house patient data in anonymized, aggregate form. To create the largest data bank in the world is our hope. We are pursuing this with Stanford University and Silicon Valley in a collaboration with Microsoft. Dentistry is the ideal model for understanding how to monetize data in the healthcare platform. Why? Because we have low mortality and morbidity, which makes it very predictable. So when you create a model, that is the ideal. We want to use this data bank to improve quality of care and, equally as important, access to care. But how? That is the big question, how? When it comes to data, I believe data will do what currency, i.e. paper money, did to gold and silver coins once upon a time. I believe the political agenda of monetary policy is out of check, and it is driven by motives that unfortunately are not aligned with society's interests. Data is becoming our new currency. We all say information is power. Now we can say this literally. Currency has to buy information. One day we'll skip that process. We don't need to buy the information because the data is in and of itself the information. Look at Google, look at Facebook, look at Apple. Why are they acquiring so much data? It is the future. It is the future banks of the world. When a machine is asked to visualize things like, for example, how many people are sitting in this front row, it has a very difficult time. If you don't believe me, ask Alexa, ask Siri to do that. It can't. But if I was to ask Alexa or Siri to calculate 3,552 times 442, the answer is just like that. And so, how do we negotiate silicone machines and carbon beings like us that have different abilities? And how do we negotiate living in a material world together when we process things so differently? Madonna in the 80s wrote the song Material Girl. I'm sure we all know that song. I hear she's coming out with a song, Digital Girl. Well, I don't think she is, but maybe she is, but I can't confirm it. But that's our new reality. Dentalytica started this journey in Palo Alto, where Silicon began, and where dataism and algorithms had the most profound impact in the rise of Google. Here we learned that data and health are the future. Stanford is so invested that they recently created an AI for Health Institute to foster this understanding better. We are in the process of developing a flagship project with Stanford. So imagine this, you press one button and your radiographs are reviewed and a diagnosis is formulated with 100% accuracy. Imagine having access to the best radiologists in the world with one click, and those radiographs have the algorithms of that radiologist imprinted in the technology. Imagine patients can access their records from their phone. Imagine knowing Carrie's risk profile when you first meet a patient, because it's on their phone and they beam their information to you. Imagine insurance policies that are democratized and risk is more evenly distributed across the population, because individualized data permits this. Imagine building a system where we are paid to maintain health as opposed to always just treating disease. This, my dear colleagues and friends, is a world I dream of a world I am working on and building with my team at Dentalytica. A world where more people can smile because we know how to gain insights into our oral health thought through the data systems we are building. Through the democratization of dental data, leading minds can build systems that are built to reward kids and adults alike for being active participants in their oral health. How, you ask? That technology exists today, like IoT toothbrushes. Does anyone here have an Oral-B toothbrush or a Philips toothbrush that keeps track of how you brush and how often and the time, and it rewards you? So imagine now that you get rewarded with loyalty points for that. Imagine when you go to your dentist and you leave and you don't have a cavity, you get loyalty points for that. Now we get loyalty points when we buy fast food. We as a society and as guardians of our great profession need to create an environment of oral health promotion and rewards to incentivize positive behavior. We need to devote more energy in developing a health system and not a disease reactionary system. An ounce of prevention is worth a pound of cure. We need to be paid to maintain health and promote health, not just deal with the ill effects. We now have the technology to do just that. Dataism is giving us insights 365 days a year, 24 hours a day. Let's harness the power of dataism and build a world where barriers to access to care are eliminated and quality of care knows no bounds. Together we can build such a world. Thank you.